Thank you, Mr. Chairman. This is an amendment that is meant to refocus our attention on fraud. We've had a conversation earlier when Mr. Camp offered his amendment, and I wanted to try and describe this in another way. Last week, the Miami Herald had an article where they described a man named Jose Luis Perez, who is, I think, figuratively laughing at us right now. Mr. Perez, according to the authorities, ripped off Medicare for $56 million. He had an enterprising partner. They were two 33-year-old guys, and they've completely hustled the system. And Mr. Perez is gone. He's described by the FBI as an international traveler, and he is now at large. $56 million over several years is gone. We've had a conversation this evening and throughout the day, and I think all of us recognize that there's waste, fraud, and abuse within the system. And to be fair, I think the majority makes an attempt in their bill to try and get at it, and there's some decent stuff. They're increasing some enforcement mechanisms. They're enhancing penalties. But the problem is that for people like Mr. Perez and his partner, these efforts don't get at those guys. In other words, the paradigm has to shift. In other words, we've got to get to the point of sale on Medicare and not have a pay now and chase later approach. And that's exactly what the Medicare system does. And even some of the other changes, frankly, that the majority has, it says that the Secretary may impose enhanced screenings, and that's all fine and well and good. But if we want to really get at this, we've got to do it a different way. And what my amendment says is simply it calls on the Secretary of Health and Human Services to establish a system to use technology for real-time data review to stop waste, fraud, and abuse at the point of sale. Now think about this. We have a credit card economy that moves over $11 trillion a year. There's 700 million credit cards in place around the world, or in circulation around the world, and yet that industry is able to have their fraud number at 0.047%. Now compare and contrast that. We were sort of laughed off the stage when Mr. Camp offered an amendment that said we had to have as a goal of 3 or 3.5%, and that was like, oh, you're completely unrealistic. And yet, with another industry that's actually bigger than Medicare, they're beating the living daylights out of us in terms of the efficiency. And why is that? Because they do point of sale. Think about it. UPS and FedEx can track 23 million packages every day, and customers can track it in real time. We can do this, but it's going to take a paradigm shift. I was told earlier in sort of these shuttle diplomacy sort of staff discussions that there was some objection to this bill based on cost, because I called to say spends $50 million a year on this. And I literally laughed out loud that anyone would suggest cost as an objection to this. So I can't even believe that anybody's going to bring that up. Because simply with one outlay of $50 million, we get Mr. Perez and his partner. So I think this is an idea whose time has come. I know it's late, but I think that it is a transformative idea that can begin to put some real serious teeth into ending this madness of allowing our constituents to be ripped off. I yield back.